Dr. Suresh Davis. I'm a consultant cardiologist at Rajagiri Hospital. I'll be talking latest updates in hypertension. As per WHO, nearly 63% of the total deaths in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affects approximately 45% people in the age group between 40 to 69 years. Raised blood pressure is among the most important risk factors for cardiovascular disease. If you see the latest Lancet 2021, in India, the prevalence of hypertension has gone up to 38% in men and 32% in women in people who are ages over 30 years. And nearly half of the people are unaware of hypertension. 51% of men and 41% of our country, women in our country, are unaware of hypertension. And the unfortunate part is that 62% of male and 53% of women living with hypertension are not getting treatment. So according to WHO, the worldwide also, the number of people getting medication for hypertension is 1 in 5 in men and 1 in 4 in females. So the International Society of Hypertension has released new guidelines 2020 to global hypertension practice guidelines. So it emphasized on evidence-based standard care of treatment. In 2021, there is another publication from the ACC-AHA that the new guidelines treatment of management of stage 1 hypertension. Stage 1 hypertension means systolic blood pressure of between 130 and 139 and diastolic blood pressure between 80 and 89. In these patients, the cardiovascular risk over the next 10 years is less than 10%, then you can treat them non-pharmacologically with diet control and exercise. But if the blood pressure remains uncontrolled at 3 to 6 months of starting non-pharmacological treatment, then you have to consider the patient for pharmacological treatment. This is the ACC-AHA 2021 new guideline statement. Another interesting factor which has come in Journal of American College of Cardiology in September 2021 is that in patients with COVID-19 and ARDS, metoprolol has shown to reduce lung inflammation and thus improve respiratory function in patients with COVID-19 and ARDS. So it is a quite an interesting fact. Now, the new studies which has been published in NEJM 2021 are the STEP randomized trial and SPRINT trial, basically done in Chinese population patients, where they noticed that even lowering systolic pressure down to 110 millimeters of mercury when compared to 130 millimeters of mercury reduced the composite cardiovascular risk by 26%. So this is similar to the findings that were studied in US patients also. Now, in 2018, the European Society of Cardiology guidelines was emphasizing on blood pressure home blood pressure monitoring and ambulatory blood pressure monitoring, especially for night blood pressures. Those people who have a increase in blood pressure at night, systolic blood pressure by 20 and a diastolic by 10, was known to have increased risk of mortality by 23% and cardiovascular events by 36%. And in 2018, European guidelines recommend use of 5 antihypertensive class of antibiotics, of which they found that using an initial dose, a fixed dose of combination like an ACE-ARB with a calcium channel blocker or diuretic is quite useful. Since 2018, there is a concern about valsartan and there was a recall of valsartan worldwide. This was basically due to a carcinogen found in these sartans, which is namely NDMA. And it's found was in all sartans, but was most normally seen in valsartan produced by the Chinese company Shanghai Huhai, which is the highest level of contamination was found at. And it was seen that 22 additional liver cancers were seen on lifetime of these patients when we see 1 lakh population. So this was a recall which was made and it was done. Now another important study is the HYGEA study, which showed that importance of ambulatory blood pressure monitoring and night blood pressure monitoring. And those people who have, they compared nighttime blood pressure therapy with awakened hypertension therapy. Those people who had a nighttime therapy had a better related reduction of cardiovascular improvements compared to those people awakened therapy. So it suggests that treatment of hypertension at night is more beneficial than starting a patient in the morning. Thank you for a patient here.